I had about 500 signs. They just brought them to my house instead of store.
Store.
And store them. Just threw everything on my lawn. I got farming signs, everything signs.
You must have 150 Stagnano signs in the town of Florida.
There's a lot.
Are there? Somebody's picking them up somewhere else.
Every
bringing
time I
them
make
over
a
there.
turn, I see that name sticking out.
If I
Like,
knew
geez.
these ones, they're missing too.
No, the other guy's got a lot of signs too on your corner, and around there, the big wooden one.
Well, I gotta say, Dominic's got good coverage. There'll be one on this side, 100 yards down the road, there'll be one on this side, then go another 100 yards, there'll be one on this side. All the way down 5S.
It's 4 o'clock.
4 or 5. We got one more bit.
Three,
2, 3, 4. Huh?
five.
You got 5? Okay, got a quorum. All right, at Finance Committee meeting, I'll call it to order. First one up we have is Social Services. Mike, just to give you a rundown. What we've done is, last week we had a presentation by the budget officer. I think Tina, you were here. And so he went through the tentative budget and what he did. And so now we're going through it with all the departments to find out if there are any changes that were made, how they affect you. This is your opportunity to express it to the Finance Committee so that we can put a report together and send it to the full board. All right?
This is just a change that we made from the tentative.
Yeah, or anything else that you want to speak to about it. You know, about your budget in general.
Okay.
All right, so.
Would it be permissible to do an opening statement?
Oh, yeah, no, you got an hour. You can.
Okay.
You can.
Come on.
You can.
Oh, we're not gonna hold it down. I had a 10-minute speech, but I'll go with it.
Go with
No,
what
I'm
you.
joking. It's
Go with what
in
you got.
big font, so I can read.
That's what I do, because that's the only way I can see.
16.
So, not a problem.
I'll start with that. Thank you, Mr. Chairman, for allowing us to speak and present. So I'll read my statement because I don't want to miss it later. This will be my third budget formulation since becoming commissioner in July 2011. My first budget for year 2012 came out quite quickly as both Tina and I were the newest employees to the department. We spent many hours meeting, looking over historical data, gained some assistance from our colleagues in other counties, and for the most part, we're confident we constructed a budget that basically met the county's social services needs in a very weak economy. When we started the 2013 budget in June of 2012, still in the midst of a poor economic climate, we had a better understanding of the fiscal requirements of the organization, and we were able to cut back on some program spending. And in several cases, we terminated long-standing contracts to local organizations, which I did take some heat for, but we managed to do it. We brought that work in-house, and it was a good decision looking back. Additionally, we did some major reorganization in several units aimed at increasing efficiency, helping us gain some staffing flexibility, as well as using advances in technology to make our work easier, simpler, and a little easier to track. In June of 2012, when we were tasked with putting together this current year's budget, who could have foreseen yet another costly flooding disaster in our county, decreases in federal program spending, a huge increase in family assistance requests, and a federal government shutdown. Last year during our budget planning season, we heard from the President and our Governor that there was a glimmer of hope and that the economy was starting to turn in the right direction. I would say that glimmer of hope didn't really rest here in Montgomery County. Last year, we cautiously assumed that we could cut $100,000 of funding from our public assistance, an assumption that was echoed by the board when you asked us to cut another $100,000 from the program. Though based on an educated guess and cautious planning, the implications of incorrectly predicting the financial need was seen as recently as last month when I stood before you asking to shore up public assistance with another $500,000. We had a 53% increase in family assistance cases since the recession began in 2008. I still hear the message coming out of Albany and Washington about a glimmer of hope and that the economy is turning the page, but all evidence to the contrary. Our budget is based on a set of assumptions, some well-informed, many driven off of historical and forecasting data, and some, quite frankly, especially in the field of health and human services, a good old-fashioned guess. Furthermore, our budget is a quantitative expression of a plan and a strategy that takes us through another year of unknowns and uncertainty. Allow me to quote an article out of today's Recorder by Timothy Thomas of Tosca & Company, the firm hired to do the county single audit. Timothy says, when you look at the big differences that arise, a third of the budget is DSS-related expenditures. As a Board of Supervisors, you're charged with managing all the stuff. I think it's appropriate to be held accountable for things you can manage, but you can't decide how many social services programs will be used. You have to be reactive, and you can only take a guess with the best guess. Well, that's what we do. We take the best guess that we can, and sometimes we hit right on. What I'm proposing this afternoon is not a grand wish list, but a request for mission essential items in pair with meeting the federal and state mandated service and program demands that we are required by law to provide. I am not asking for anything more than I think this department needs to accomplish the mission. Thank you for allowing me to make a statement. I'd like to introduce my team, Johanna Del Costello, Director of Eligibility, Robin Weaver, who's fairly new to this process, been here a year, but she's Director of Services, and of course Tina Sweet, Director of Finance, who has brought everything we have, laptop, software, and we're ready to go. Thank you.
Okay. Does somebody want to like discuss any of the changes? I think there might have been changes in personnel. I think that might have been removed from here. So whoever wants to speak to that and why you feel that you need that staff. So whether you want your staff to deal with that or
Yeah, we could pass it out. I think that would.
however, yeah.
Yeah, we made copies.
As, same as we did last year, we put together a resolution, a proposed resolution. The back page is a budget to actual comparison for the last 8 years. It's been mentioned in several instances about how much social services has given back to the general fund. I want to point out 2013, we did give back 1.6 when we did the budget for 2013, as Commissioner mentioned. That was reflected in 13, it was not reflected in 12. Okay.
I'm gonna give you my copy.
What I did here is I put back everything, we're asking for what Sean took out, pretty much in a nutshell. One change from the tentative, we decided to eliminate the new caseworker and ask for an upgrade of a current caseworker. So we're only asking for one new caseworker, not two. That's what's different from the tentative.
You want to hit the revenues first, then we can move
Yeah.
on right to the budget?
Yeah, the revenues are putting back exactly what Sean took out. What's that? No, the revenues. If we get back everything that I had in there, I think we're pretty much set. Down the line, we're asking for our microtech to be upgraded to a network engineer. That coincides with the data processing unit. They asked for an upgrade for theirs as well.
Yes, speak to that. Our current micro tech is doing all the work and more of the network engineer. And we're actually putting more on that position this year as we try to really take in all the technology that's out there. She's actually doing more than what the network engineer specs are. We feel it's certainly somebody we want to keep because of the experience and investment we already have with this person. And knowing what's the going rate on the market, I'd like to invest in this because this is something this is where we're going. It's all data driven, and we have a good position, a good person here who knows the outlay of our organization. She works very well with the team, with Jan Cologne's team across the tracks. And we think this is a good opportunity to upgrade.
Yeah, before you go to Bill. So just to go back, the revenues that you're putting back,
Right.
are based on those expenditures
Yes.
that the tentative budget took out.
Yes, correct.
All right, so the net increase from all of that is $91,000?
We're returning to the general fund. We're actually reducing our budget by 91,000 with this resolution.
Okay. All right, Bill?
We-
My question would be is, why is there a difference in opinion on the revenues? That Sean doesn't believe you can,
Sean took out
Bring those in.
Sean took out $43,000 to offset the expenses that he took out. He reduced our expenses.
Oh, I see.
So he reduced our revenues.
Okay.
Now I'm putting it all back in.
by removing something on the appropriations side, you brought your revenues.
Yes.
Okay. Very good. Thank you.
Okay, Bill? Michael?
I'm looking at modified 2013, and I see that your family assistance went up quite a bit,
Yes, it did.
okay? And also what's the social services administration here? You just changed that a little bit. It was at 3827, got it 4210, what?
What's that, 3610 or is that 4610?
46.
That's our federal administrative revenues. We are going to touch on that in a little bit, but health insurance, we've changed to our actuals, and our actual expenses are more than our budgeted previously. I do a fringe benefit percentage, and I think I'm going to claim more fringe benefits next year. So that's more revenue coming into this county based on actual health care costs.
We've done that since January 31st. So we've got, what, 7 months of
January
actuals?
1st.
January 1st. So we have actual, that data from them of actuals.
I see you got extra in your food stamp program, so they didn't mess around like they were saying in Washington.
Not yet.
Okay. And then the safety net seemed to have gone down quite a bit.
We aggressively work on safety nets. That has a lot to do with the job developer and some of the intense work that my occasionally do.
And one last question here, what happened to Medicaid? It went down, the expense.
That Medicaid is a big unknown right now. We've been getting emails from the state. They don't know the 2014-15 budget will be out in April. That's a big guess. But based on our emails we've gotten in the last few weeks, I think we can reduce that by 100,000.
That's a 2% decrease.
The other thing is, they're charging us 53 weeks. We pay $232,000 a week for Medicaid. And that's, next year, there's 53 weeks in the year, not 52. So there's another extra 132,000 in there. That's why it's up. But based on what our emails we've received in the last few months, I think we can reduce our appropriation by the 106,000. But there again, it's a guess. Until the state budget comes out in April, it's a guess. Educated guess.
Wasn't the Medicaid capped at 2005 plus 3% a year, whatever it is, 2%, 3%? So is it fixed or does it still fluctuate because?
It fluctuates. They're saying it's still going to go up 2%, but our emails we received from the state said that 2% that we predicted would go up next year, they don't think it's gonna. It might stay the same, but there again, the state doesn't come out till April.
Well, in their attempt to like so offset the takeover? I mean, because they're being asked to.
They're saving money.
Sure, they're saving money now during some of the initiatives that came out with the Medicaid redesign. They're saving some, maybe not saving some in upstate, but they're saving some downstate. So the Medicaid admin cap is stable for next year. It's stable for next year, but going past 2015, as the state fully assumes Medicaid administration, you're going to see it dwindle. I think your Medicaid admin cap is going to get cut probably down to 25, 50% in 15, 16. 2018 is the state has to take it over by law. So the only thing we'll be left with in the county will be the long-term nursing and some of your really difficult cases, some of your disability cases. we'll be left with that portion of Medicaid, which community Medicaid be fully assumed by the state.
Okay, I'm not sure. Did you have any more questions, Michael?
Not right now.
Okay. If no one else has questions, then let me, because we're going to go back to that health insurance reimbursement and all that. That's why I asked Sandy to show up and Daryl, because we're making the transition over from the trust accounting to our accounting, and what effect that probably will have on the impact in your budget as far as reimbursements. Because I've heard a number for 2011 that is quite astounding, that when we get to that. All right? But I started to share this concern with you last week. Well, not you directly, but the concern was with I expressed it to Sean, not about Sean, but with Sean. And it's ideally it would be nice to that number at the end of the year be zero in a perfect world. All right, that you're not using that because when and I try to express this is that when our budgets are tight, what we do is we often lock monies up and they're locked up with you until the end of the year, and they'll either go to fund balance or, you know, I mean, which is nice and admirable. But at the same time, we're being criticized by the State Controller's Office for appropriating fund balance because they believe that we're living on it. Now, there are years that when we have appropriated fund balance and used it. Obviously, there's a lot of years because we went from 20 million, let's say, down to 5 million, whatever. But last year was one of those years where, again, we're going back up. Now, we knew we were going to go back up in part because of the budget for sales tax. All right, that we could sort of tread. It was your additional 2.3, which helps bring it over, because our fund balance, rather than using 4.9 as we budgeted, as we learned last night, our fund balance actually grew by 1.5 million. All right, so that means that we missed the budget by 6.
Can I say something?
Yeah, you can jump in
Yeah.
with
That's
both
why
feet.
2013, I reduced our total budget by 1.6 based on the historical data. 2009, we gave back 2.6 million. 2010, we gave back 2.4 million. 2011, 3.3, and 2012, 1.2. Now, as Mike said, we got here and right in the middle of the budget season for 2012. It was pretty much a status quo from prior years. 2013, I don't think you're going to see 2.2 at that at the end of the year, because I took it off the budget, 1.6 million lower in 2012's original budget, based on a year of learning how the social services budgets.
That part I understand, I appreciate, because it is, as I've been told, and that a lot of it is historical data.
It is.
So a lot of that, if there was a, I don't like the term give back, giving back, but the thing was that historical data is all you can go by. You and probably public health. It's not like saying I'm constructing a road and I know how wide it's going to be. I know how much blacktop it's going to be. I can sort of figure that one out. You know what I mean? But yours is based on what you perceive the economy to be and what the effects that's going to be on you and what the population is. So I understand all that. But there was like 3 programs, I think, where most of the money, the differences were. Because if the administration costs, the employees and all that, is pretty much fixed for, I think, because the only thing that would be different is the employees.
The
Yeah.
other thing is the state budget comes out in April, and that's 9 months of our year.
Yeah,
They decided to give us more money in 2012.
Well, that's a good thing.
Based on a budget that comes out in April, I don't know what April's going
no,
to bring.
I understand that.
So,
And then the other part is that the Medicaid is basically fixed, whether it's 52 weeks, 53 weeks. That's more of a fixed cost. So, you know, basically the differential is like in three, last year, 2012 was actually like in 3 programs. So I just want to make sure that we have a good handle on those 3 programs, or a better handle.
I think
You know, it's 3 I'm talking about?
family assistance is one of them.
All right, let me give them to you quick. And then maybe we can talk about it. Probably the biggest one was childcare. I really haven't gone through it. I didn't get an understanding of childcare probably in 1999, so I could use a refresher
Is
course.
that the 6119 number?
Yes.
Yeah,
That's-
yeah.
Okay, that's actually our foster care program. And it's not actually child care, it's actually foster care. I don't know why it's labeled
Yeah,
child care.
it's listed down as a childcare center.
We had 8 adoptions last year. And we had older kids age out of that program. And I will say something to that, but
I mean,
our
that was,
expenses went down.
yeah, that was a budget that was like $1.8 million,
Yes.
and I think you spent
Yes.
like $1.3 million.
Yeah.
One of the other things, just in addition, because of my concepts coming in, I am big on permanency. These kids need to be home, and I'm pushing that. We're moving kids lower levels of care and moving them back into their homes. That's where they need to be. So we, when I came in, there were little case conferencing. If the judge ordered the child to be in care for 12 months, they stayed in care for 12 months. We're looking at that. They, are coming into the system in a residential facility at $200,000 a year. And for 9 months, their behavior has improved. They're doing what they need to do. They don't need to stay in foster care for another 4 months. We're trying to get them home, get them, that's where they need to be, or at least into a lower level, which is cheaper. And so that has been a big push as well.
Is that mostly our cost, or is that burden shared with the state and federal government
It's shared.
Shared.
in a big proportion, or
What's the big?
I think it's what,
It's
more than that.
what would that be, 1819, 3619, and 4619?
I meant to bring it for you.
Are those the only 3?
Just a minute. I'm gonna say it's 6221, 62 federal, 21 state, but I can email you those percentages.
You know what, I mean,
There is 62% of
17.
state.
17 state.
because when I look at, let's say, the revenue account,
That's
1819,
also the foster care block grant. We get 1.4 million through that grant, and then the rest of it is local share. So we're working hard to get under that cap. We're not quite there yet, but we are working. 2 years ago, we were $2.2 million over that block grant. Last year, we were $800,000 over that block grant. I'm keeping the budget almost the same because one kid in care is $300 a day. We could get 20 kids next week.
It's a
There's
yes.
several families we're looking at right now that are just, we're just on the brink of coming to us. Mental health services, and there's wraparound services going on, trying to prevent that, because we know it's costly when it comes to us.
I know it's
It's
always
very
been
difficult
difficult
to
to
get
get like foster parents and all this other,
So we're trying to really reduce placements, as Robin said. That's something that the state's trying to do and really focusing on, is keeping kids permanency in the home. And we're really trying to do that. That was one of my justifications for bringing Robin on board, was to have somebody look at these. Can we downgrade and lower the level of placement of these kids and save us money? And we've been doing it. We're looking at another contract now with a company that's even going to take us further, that we're looking at next year. Maybe going, they're talking about they will help us out for free, show us what they can save. So it's worth looking into.
Okay.
Residential treatment and stuff, we try to get out of that.
You know, because I was just looking at what is our biggest exposure, you know, and so that's why I was looking at that, because you know, I think the revenues that were budgeted were 62, 730.
We just had that
Maybe,
murder.
if I look at the 19s,
That was $900 a check.
yeah, but no, if I was looking at the 19s, you know, either 18, 19, 36, 19, 46, 19, you know, those revenues totaled, out of the 1.8 million, those revenues totaled half of that,
19?
you know, so I just, that means the other half is our exposure. All right, so if we can reduce costs there, it becomes a bigger reduction for us versus some program that is 90% state and federal. You know, what I mean, we don't get the return on that one. You know? Yeah, Michael.
I just need some information from you. I'm new with this. When someone tells me they have like 2 children in their house, they're under foster care, is this similar or is this a different? So if a person takes, let's say, I know people who've done this. They've taken like 2 children, maybe some of them, they were not maybe necessarily from here in New York City. They're paid through those programs?
Yes.
For my office.
Okay.
Through these, through this.
Okay.
And they have to be certified.
Right.
We go through a training process, and we contract those out through different organizations. We pay the organization to find foster parents, train them, but that's what those costs are.
And those rates are.
The higher level, yeah, the higher level the child's need is, the more costly it gets. And a lot of the higher costs are your persons in need of supervision children and your juvenile delinquents. They're hard to place them in a therapeutic foster home. A lot of parents, yeah, I don't think I want them. You know, they need a higher level of care, and when you start getting into those residential institutions, the rates are really, really high. And you can just,
Easily 250,000, 300,000 a year for residential placement. We have one kid in a position like that right now. She mentioned the child murder we had last year. That was a placement that fell back on us. It was $900 a day. Until he ages out.
How are these numbers determined?
The state sets the rates. We have nothing to do with that.
we don't get to decide.
It's state puts that.
$250,000 a year?
Through the state ed program, the state ed program. That's-
So we do everything we can to prevent it from taking place. A lot of late night meetings, and we get the mental health, everybody around the table, we try to be very creative on what we can do. Always cross our fingers.
And we take a lot of criticism, our department does, for not taking these kids sometimes on a voluntary placement. They say it's not really into the court system, the parent's not really neglectful, but they have all these mental health needs. They push the department to take these kids into care on a voluntary, and we are faced with that a couple times
Yeah.
a
We're very
year.
careful. If we have a voluntary placement without a court order, then it's all ours. We pay for every bit. So I say no all the time, and I get into discussions with judges and providers saying, you know, you're heartless, and I said, I'm not heartless. I'm thinking about, I can take care of a lot of kids. I can't take care of Johnny over here in below my budget, you know. So I care, but I also have to be fiscally minded with what I'm doing. I may get stuck with a kid for, if he's 5, I may get stuck with him until he's 18 years old at $200,000 a year. So I've got to be very careful.
Okay, Michael?
Yeah, for that, thank you very much.
The other one was juvenile delinquents. I remember going back to these discussions when they raised the age from 16 to 18. You know, and so that threw more on us. I mean, that's probably 10 years ago or more, you know, that it happened. But that was another one that there was a difference in the unexpended column of almost $400,000.
Right. And that's JD Pins.
Just JD Italy.
Yeah, JD, that's juvenile delinquents. It's the same as the foster care.
Juvenile delinquent PINS, it stands for Persons in Need of Supervision, just so everybody knows.
So
That's
it's a different category.
It's just
but
how
the
they're
same.
placed through the court. It depends on the crime they commit. If they're 16 and commit a crime, they can be charged as a juvenile delinquent. PINS is more of your ed neglects. It's not really a crime. It's a lot of truancy. They're not going to school. They file up, or they're out of control at home. But it's not an arrest. They get charged with a person in need of supervision. So it really depends on the category that they're placed in family court. But it's the same thing. They come in, they get into these residential placements. They're the ones that are likely to get placed in detention. And that is very hard to predict because if it's a child that's very hard to place, they could end up being in detention for 30 days. Some of them at $300 a day. So it's this guessing game of what we're going to need. And I think that we have been really trying. That's fine. They get placed, but we need to work hard at getting them back on track and back home. And I think that's one of the reasons why maybe we over budget, because we are trying to reduce that.
We can reduce those lines if you'd like, but I'd also have to reduce the revenues, the 60% in the federal and the 17% in the state. See, it's about 22%.
That was going to be,
20% local share.
yeah, I was going to go back into that. Again, it looks like, well, it's basically local and state?
It's federal and state.
Federal,
4619.
that was the child care.
Oh, and
I was looking for the 23 that matches up with the,
there is, it is just state, the 3623.
23?
Yeah.
So they're like that
And it
800.
goes- there is no 4623, but
Right.
it is grouped in with the 4619 as well. It's foster care, JDP, it's all the same, foster care block grant.
Okay, so you're taking that federal part and hitting a couple of different,
Yes.
okay, just so I can better understand. I got Barb first?
Okay. From my understanding, and I think I've talked to you a couple times, the PINS is more of a preventative action before the situation gets worse.
It depends. There's PINS diversion, which is a preventative program where we try to work very diligently with the child and the family to try to prevent them from coming into placement. But once they're adjudicated and go to court as a person in need of supervision, the judge really makes the decision if the child needs to go into placement. We, at that point, once they get to court, we don't get a lot of say. I mean, we try to advocate and say, let's try community service or put other services in there. But pretty much we've done all of that once they get to court. So it really depends on where they're at with the PINS.
Can you give me a rough idea about where we stand with the PINS, whether the numbers seem to be growing larger, remaining consistent, decreasing?
My guess, and I don't have all the numbers,
Right.
is it's growing.
Okay.
But I think that there are some reasons to that, and one of the things that I actually have done today is we are reorganizing services, and we're going to have a specific adolescent unit in services to really target that population, because that is one of our, fortunately, costly populations, because those are the kids that are likely to go into the higher level placements. So the way we reorganize that, we will have a group of 5-6 workers that will just target that population. And they'll either be working with them to try to divert them going into placement, or once they do, to try to get them services in and get them back home. And again, doing aftercare services when they come home, so they don't end up back in care. So, because that happens as well too. So. stuff.
Okay, Mark?
Thank you,
Butch?
thank you.
Yeah, I just don't know how to put this, but I'm gonna say it the best I can. Once this is determined, this is really my own, the parents and everybody's off the hook except for us in the state.
No. When a child enters the foster care system, a referral does go to child support, and they are brought in to have to pay child support. Unfortunately, not all, but a majority, when you times 17% of child support times zero income, it doesn't get you much child support. And yeah,
So
unfortunately.
basically, they give up and not we, but the state and you guys get stuck with it. I mean, I'm just bringing it out. I mean-
No,
that's the bottom line.
I mean, they are
In some cases.
held accountable. They have to work with the, with the department. They have to attend meetings. They have to do their visitation. I mean, they have to be a part of the plan to get this child back home, or we can go the route of a neglect as versus having the child placed. But whether they're placed in as a neglect or a PINS or JD, they're still ours, and we're still paying the cost. I mean, again, if they have an income and they're working, we do pursue child support against the families, both parents. But unfortunately, they are low-income families or no income. But they are
I mean,
held
they're the ones-
accountable.
They're probably the ones that should be put away compared to the kids. Thank you.
Some of our revenues from the child support unit are in the 1800 series, 1819, 1823. Those are from our child support unit, from our cases in foster care.
Those families that do contribute.
Yes, we get a monthly check from child support.
Okay, the last program that I can talk about is a state training, which I think is all ours. All right? Now, there are years that you don't spend anything. There's a couple years that you do spend something. There are years that we budget, but we still have not spent any money on state training. And then we budget, we budget, what is it, for maybe?
It's 100,000. I budgeted 100,000. We have one child in a state training facility. We haven't got a bill. And actually, he's aged out now.
He's in jail.
Yes, but we have one going in too, yes.
What kind of cost is that? Well, okay,
It's over,
first of all,
over $350 a day as well. It's
all right,
just like,
explain what the state training is so that we all know what it's for.
They're not in our care and custody, but I believe it's the child with the developmental disabilities, the deaf, blind. They go to the school. One of the children that we had goes to the school in Rome. That unfortunately becomes the responsibility on us.
So
It's not neglect, it's not behavior. The child is in the parent's custody, but somebody has to pay the bill, and it ends up falling on us.
all right, so it's not you, I mean, it's not public health, it's you.
right.
It's
When they turn 5, they come to us.
It's one kid. That budget line is one child.
It is one child, yes.
And I think we've been notified that there may be one coming in from St. Johnsville that is going to be 5 and will be entering the school system. Oh, sorry.
No, that's all right. You know why, the only thing is because there is no aid. There doesn't seem to be a revenue line up there, you know what I mean, for it. So it's all our expense. Where a lot of times at public health, it's, you know, it may be a lot of our expense, but there's some reimbursement somewhere.
I don't know.
You just brought up a point. Is any of this, do you go back and forth with public health to see if they can take these where they can get the revenue, or isn't that
There is some overlap with 4E foster care money with public health. That's not a lot. I don't think.
so somebody that
They're working.
requires this training or anything can't be put into either the school system or the
Yeah, it was.
public health or anything like that, or nothing? There's There's no overlapping programs now?
Okay, if there's no more questions on
I do
that.
have a question, just out of curiosity. Is this consistent with throughout the United States? Do they have these programs in every state?
Yes, I mean, for the most part, I mean, I can't speak, but talking about New York and California and Massachusetts, you know, the larger states, yes, they're pretty much all.
Same dollar amounts?
That's quite, that would take a study in itself, who reimburses what. I would say your more conservative states like North Carolina, probably not. They probably don't. The local government probably doesn't fund like we do.
But New York mandates it.
A lot of it's because of our Constitution. Section 17 of the New York State Constitution is very clear about taking care of the welfare of the child and the needs of the citizens. It's in the Constitution, and that's something you hear all the time. Anytime we as commissioners band together and go after, one of the things we like to do is do family sanctions. When we sanction somebody now, okay, because they're not doing something, we only can sanction one person in the family. There might be 7 or 8 people, okay, in the family. We can only sanction one. So sanctioning somebody's like, who cares? So I'm going to lose 2, 3, or 5% of my thing. Who cares? But if we can sanction everybody, that would get their attention. But for years and years and years, commissioners have approached the state, the assembly, and the senate with these kind of petitions, and they've said, we're not going to do it. And once again, we're going to try it next year again. But the state has a long history of basically saying, hey.
Okay, Michael? All right, last night we had Koski, who gave a presentation on, I mean, I haven't read the paper, but they gave a presentation on the audited financials of the county. So one of the things that we discussed last night was, and they brought it up, was talking about the transition from the quote from the trust to what we're doing. And I think, Mike, you spoke of it earlier when you said as of January, we're looking at reimbursements differently.
Yeah.
As a direct cost rather than an indirect cost. One of the things I think it came up was, and I think they mentioned it, is obviously we're trying to transition out of the old and finalize those books so that we can close them. One of the positive things that came out, of it, was obviously this going from the cap for the versus the direct costs. All right. I think you've been working with Tina with Daryl and Benetech over, I think, 2011.
Yes.
All right, and I think that my understanding is that we applied for reimbursement for like 990 something thousand.
I haven't got any numbers for 2011 yet.
The ones you gave me, he's referring.
Oh, okay.
The original
actuals.
claim.
Yes. The original claims were 900,000. Yes, for 2011.
Now, if we can go back into 2011 and reclaim the actual direct costs, I think Sandy, I think she's worked numbers, which I think she's going to give to you, or going to give to you, because I think you need something to go.
I need them by December, yes.
Yeah, and so I think the numbers that have come out in direct costs are what, $1 million?
They're about $347,000 over the 997.
So we can actually look at reimbursements for 2011 that we could jack up another 350,000, pick up prior year expenses that weren't picked up before. So that's the one thing that has come out of the transition. Plus, you now know, because we're accounting for almost every department, the actual costs.
Yeah, that's going to be at unbudgeted revenue for 2013. Because it wasn't budgeted. And it also includes the retirees,
Yeah,
which we have never claimed for.
right. Will that help you at all in numbers that you were working on for 2014? Yes?
I could probably revisit the administrative. Right now, our fringe benefit percentage is based, I revised it in September, based on January through August actuals, and I included the retirees' health insurance, which is 1.1 million, I guess, is an educated guess for 2013. That brought our fringe benefit percentage up to 57.9% of everyone's salaries. That's up 3% from last year's estimated fringe benefit. Now, I'll change that to actual once we finalize the year. I can revisit them based on 11s and look at it. I may be able to increase those lines.
All right, I mean, we're only going to pass on a recommendation here to the full board, so the budget's not going to be adopted till either late November into December could be. So if you could work on the numbers.
Based on that, I can maybe do an estimated 2012 additional revenue and add that to the budget as well.
So that'd be good, that's good news for us, so.
Yeah, just if it doesn't happen, don't shoot the messenger.
Okay. No, I'm not going to. Anyone else got any questions for social services? All right, if not, thank you.
Thanks.
Thank you.
very much.
Good job.
You ought to go back down the road or something.
Thank you.
Okay, so, I mean, if you want to, well, if you want to expand on that, be my guest. So that, I think, so that we all get a better understanding of what actually the difference between the numbers means.
Well, there's really about three aspects to it. There's the older numbers, the 7, 8, 9, 10 years. Those will, if we can at least get up to the amount of claimed amounts that have been given to us by Tina, what we'll do is we'll recognize all that deferred revenue that was accounted for 12, so that you could get a better audit result in 12. All right, so there's a lot of money there, over $4 million, isn't it, Sean? That we would now re-recognize as revenue, because Sandy now has the totals that Tina claimed, and if the actual expenditures are greater than that, even by $1, we will have earned that revenue that we'd already received. We won't be able to go back and get that. That will be lost money, but we'll know that total, and that will be lost revenue for not having done the accounting the way it should be. Now, in 11, we get our first glimpse at the windfall, if you will, by doing it correctly, by charging the costs as they were incurred for those employees. That's a lot of money. 350,000, could be a little more. Then there's the next period, which is 12, which will be worked on, and Sandy will be charging on that, because we don't want to miss that time frame in which we can file that supplemental claim. So we'll capture those monies too, because again, retirees weren't weren't charged then either. So I would expect, depending on the health of the department, we could see something in excess of what was put there. 13, obviously, they've made some changes, so now this is now on a different track, where now we're watching actuals, and so that she's able to make adjustments as the numbers change, either up or down. All right? So this is going to be kind of the tail end here, if you will, of any actual windfall, but what we can learn from this is that the general fund now has some help, if you will, from a federal and state reimbursement ongoing. That as you continue to be self-insured in this area, you're going to get some help when you can charge these costs directly to grant programs and get the money back. And that's important. That their budget, as you were doing, commenting, is their budget is for every expenditure line item. You should be able to come up with a percentage of reimbursement of either state, federal, or then how much is the local. So you can then make these adjustments. And that's kind of what we've done even in the budget for the M fund, is that every expenditure should have a source of revenue to help pay for it, or where's it going to come from, so that you know your net cost. So I think that, you know, this has been a positive effort to go forward, and I think it's also a direct result of congratulations on your new audit result, which was an improvement over 11, a substantial improvement. Right? So that's very good. That a lot of good things have happened as a result of this effort.
I agree, and I can appreciate bean counters more than I ever have before in my life. I think my confusion comes from, and I've attended a couple of meetings concerning the trust and the vitality of knowing all of the transactions and going back to 2007. But we're doing meetings, so are we not meeting with the personnel department at all? No, but when you scheduled the...
Health insurance was the M fund. I did the M fund last year.
No, but are we not going to be meeting with the personnel department?
We only got 20 days.
No, but did you ever schedule them? I know that this week, but, and I appreciate, because there is a self-insurance fund, which I appreciate that we're going to be going over, but we normally meet with the personnel director?
Yeah,
Are we not?
No, when I went to schedule, I scheduled those first ones that we had last week.
But we didn't have the personnel?
I didn't know he was going on vacation this week.
Okay.
Or else I would have scheduled him last week. But I'm trying to schedule in the sequence of like health insurance being last, which was 9 million or whatever it is total is a big number. The only bigger number is Medicaid and personnel costs.
Right.
Insurances, whether it be dental, vision, health, and drugs, is the third largest cost in the county. So I was trying to hit that last before we close this our hearings this week.
So if we have some questions, and I'm not on the finance committee, so I apologize, but, and thank you for letting me ask questions, but some of the questions if I had concerning the budget, would you be able to answer? Or would you?
Well, Darren's here with Benetech too.
Okay.
Darren's not. He's just here to transition between the health insurance from social services to
Right.
from the trust.
And Benetech does our health insurance, but is somebody from the county who's, or did Benetech do the budget?
They're doing the budget.
They did our budget, okay.
Well,
Thank you.
he's presenting you his actual workings.
Okay, so, but Benetech submitted this budget for the county?
No, they threw that in because it was early on. Personnel threw those numbers in.
So this is from personnel, not Benetech, but
They're not from
Benetech's
Benetech.
here.
Just like last year. Last year, I put together this spreadsheet that did, you got spreadsheets to pass out? Yeah. Yeah. Let's go through that, and I think then Barb will get a better idea of what this is. I tried to explain it last year. I guess I didn't do such a high job.
Well, I just know that the personnel director was here last year, so if I had a question, but there might be answers to my question right here. Thank you.
What page are we on now? The unfunded first.
What was your name?
Darren.
Darren. That's right, thank you.
Dominic, if I may, that's an important transition element here we're looking at, is that the M fund and the workers' comp fund, if you will, those two funds, because they are internal service funds. When their budgets are complete, then you can then in turn begin completing the budgets for the general fund, the highway, et cetera. Because when you're collecting all the costs inside of an internal service fund like health, you have to first determine what those are, and then how much was social services, how much would be for public health, how much would be for various funds, so that then you would share that information, and it would then go through the rest of the other fund's budget, if you will, as a source. And then in the case of social services, revenues get attached to it. So it's kind of like you have to know your expenditures first, then your revenues can become known or more clear, and then you will know how much is your local share. And that will be the same with workers' comp. Now, workers' comp is a little different because the risk has been transferred to that fund, and therefore a premium equivalent is appropriate under that circumstance. But one of the corrections the auditor did make this year, with the help of Sean, is that there was a deficit in the workers' comp fund. Now that deficit's been removed, because there can never be a deficit in the internal service funds, ever. It's always owed from someone else. Whoever is benefiting from the service, they must pay. So there should have been an accrual of a receivable, partly from other governments and partly from the county. Now, we decided that that was not due. It's not a liability in the general fund just yet, because it represents the incurred but not yet reported liability, and because of the accounting principles that it is owing, but it's not due. So it's not a current liability, so it resides over in your W fund. Probably remain there forever. In fact, you'll never fund that currently through a budget except through your normal premiums that you pay. So workers' comp is a little different, but we did fix that deficit there. But it does not affect your budgeting for a general fund, except for the premium equivalent that was established by the personnel department. Now, the premium equivalent is still established in the M fund so that we can withhold the right amount of monies from employees because they participate. So we do create that concept of a premium, if you will. But bottom line is, the county ends up paying for all the costs that are incurred, except for those that are from grants and can be funded by that. So it's very important, that's what we've been doing, is sorting those costs so that we can maximize our reimbursement under your other programs. And so now that's how, what Darren has now played into is he's now helping us with the M fund, coming up with an understanding of what costs we expect to incur so that we can establish that rate, so we can withhold from employees, and yet at the same time assist the DSS people in completing their budget. And I think that then brings it full circle as to how these are integrated.
Okay. Darren, you want to, where do you want to start?
Good evening, everybody. I'm Darren Moser from Benetech. Here to talk about the exciting world of health insurance tonight. So, first thing I want to do is I just want to say I used this format that was given. This is what the county put like in the budget last year. So this is not 2014 adopted budget because obviously it hasn't been adopted yet. But I just wanted to point that out. That's just the heading that I have on here. Basically, what I wanted to do is start with the expense side, because that's really, we need to know what the costs are going to be for next year. So each of the pages is numbered at the top right-hand corner. If you could turn to page 4 in the packet, okay? And I'll go through the numbers for the health insurance fund. The first number that you will see is the human resource clerk. And that is the amount of money that's set aside for that person's salary for the 2014 plan year, which is, I think I put in like 2% on top of what the number is for 2013. And then we go down, again, these are headings that were used last year in the budget projection. Office supplies, we put in $500 basically, for papers, things along those lines. The next big item, and please stop me along the way if you guys aren't unsure or something.
Yeah, I'm unsure of where the 2% for the, I'm so sorry, I don't mean to be difficult, but where are these, did you talk with, was there communications between you and the personnel director, or?
That's an assumption that's put in there, okay, that the 2%.
Well, we gotta go back. I created the M fund budget last year. Personnel did. Yeah, the budget you adopted last year was an M fund budget that working with Darren, this Excel spreadsheet that you see in front of it is my creation. All right?
2% is roughly $500, $600, okay? So we're not talking in the grand
I
scheme.
guess we gotta repeat the concept. The concept is to take all of the costs as if this was a mini insurance department.
I understand.
No, I just said, so everybody, so it was a mini insurance department, and this is what your cost of health insurance would be. Now, we don't have all the costs in here that we could possibly have had, like an actuarial, and things of that nature are not part of this budget because we haven't gotten there yet. So what Darren has done is taken the spreadsheet that I created last year. The first person is the person who works the majority of the time on insurance, and that's Caroline. So that's her salary.
Right.
All right? And so then Darren can go after that.
The next section you'll see is called self-funded insurance administration, and that 230,000 number is a sum of the 6 numbers that you see over on the side there. And that's broken out into different categories. Insurance consultant, that is Benetech, doing the consulting work, coming up with the budgets, plan designs, Medicare, helping out with the Medicare portion of the program. And that number is a fixed dollar cost. That's the same number that it is in 2013. The dental administration fee, again, is in the contract. There's a contract between the county and Benetech. What that is for processing the dental claims for those members that were in the MVP plan prior to moving over to the Empire portion of the program. The Empire portion of the program does not pay for the routine dental visits that the MVP plan did, so that's being self-funded through the county. Same thing with the vision, okay? MVP had a vision benefit as well, and that vision benefit, the administration of that by Benetech again, for the MVP population is $2,550 for the course of the year.
Those two costs were contractual obligations that we had to maintain when in prior years they switched from MVP to what we currently do
Yeah.
with Delta Dental, Davis Vision. There are still some that have the old benefit, and so that's why those numbers, they've always carried forward. They've always been in separate contracts with Benetech.
The benefits administration fee, again, that is Benetech, and what that is that's the daily interaction with the county as far as helping with claims process, retiree billing, eligibility, audit material, that kind of stuff, answering members, working with the personnel resource department. Any of those kinds of things go into the benefits administration. Again, that's a contracted amount as well. The next one, Empire administration fee, what that is the fee that the county pays to Empire to process the medical claims, okay? And that's a per dollar per month fee per head.
Okay, hold on a second. I got Barb there.
Okay, I'm sorry, so there's two, the insurance consultant, that is payment to Benetech for consulting themselves, and the benefits administration fee is to the
That's the
same.
day-to-day, that's the day-to-day operations.
But it's both to the same company, so.
Correct.
Okay, okay,
So are the other two in between those.
Yeah.
right. So they're all, okay.
First four are all benefits.
to consult themselves.
The next, as I said, the Empire administration fee that's for Empire processing claims. If your members call into Empire, the network, all that is in that $137,000 fee. And the last one in this section here is the Delta Dental Administration, and that's the fee that Delta Dental charges. Again, it's per contract, per month fee, and that's for processing the dental claims for the non-MVP people, the rest of the county, the big majority of the population, as far as their benefits there. Okay? The next one we put in, which was the same as last year, was postage expenses. If you have to do mailings to members, letting them know about any change to the plan or any updates or anything to the Medicare population, so we put $500 in for that. So the total for that piece is $231,500, and then when you add in the salary, the amount is $260,000. If we turn to page number 5, the next one there is called stop loss insurance. And what stop loss insurance is that is on the medical portion of the program. That is to protect the county against any large claims, okay? For instance, if the county had somebody that needed a heart transplant, and that cost $500,000, the county would only be responsible for the first $150,000. The rest would go through reinsurance on that. That's what stop loss insurance is, okay? So
And that's a contract that the county enters into when we enter into a contract with Empire Blue Cross.
Yes.
Also.
Right, with HM
So this
Life.
one's HM Life.
Right. HM Life is the vendor that Empire has placed the stop loss with. What we do is we go out to multiple vendors in the stop loss market. We even ask Empire themselves to give a quote because we want to get the best dollar value for the same quality service that we can get. And strangely enough, Empire came in and they have all the claims information, they came in almost twice as high as HM Life. So HM Life is where the price is. So this number is again, these numbers are all based on current population. If your membership goes down a little bit or it goes up, then a lot of this is per contract, per month material. Okay. The next line is the fringe benefits, the FICA tax, and that is just a percentage of the salary that you saw on the first page. Now we get into the actual bigger portion of the expenses, which are the hospital and medical expenses. The Matrix claims expense, and you'll see the next line says the Canna RX. Matrix is your vendor for statewide drugs here, for your drugs that members take either retail or in the United States on mail order, okay? And Canna RX is mail order claims that certain brand drugs can be gotten through Canada RX program.
So, okay, let's this one.
Yeah.
Okay.
We do not have, they're not able to, I've talked to many people concerning that where they're not able to order. We've changed our prescription plan with the county, so Canada RX, but this is residual bills is what you're talking about.
No, you may be talking about the Medicare population. The general public can still use
The general
Canada RX.
public, but can,
General employees, when he's speaking, he doesn't mean the public, he means.
Yeah, general employees of the county can still use Canada RX.
That didn't go away.
okay.
Just the Medicare population was pulled out of Canada RX and Matrix because there was a Medicare Advantage plan now.
Okay, so with the Canada RX, there was no change with the co-pays in the county, so we're still good. Okay, thank you so much.
So the number for the Matrix and Canada RX came directly from Matrix themselves. They did the calculation, they did the estimate for 2014, and they got the input as well from Canada RX. So that number of $591,000 is the estimate for 2014. Now that number, just to put it in perspective for you, that number was well over $1 million in the past. But by pulling the Medicare population out and moving them to a Medicare Advantage plan, there's been significant savings on the drug side of the program. The Empire Blue Cross claims expense.
I don't want you to get confused now. Restate that, because I,
About the Medicare Advantage, what we've done in 2013, the county went to a Medicare Advantage program for the Medicare population. And what that entails is that the county pays a premium to Empire Blue Cross to cover those members, all their health insurance claims, all their administrative costs, and all their drug claims. So by paying that premium, you're getting in one package a cost, and that cost has had a significant savings on the drug side for the county and the overall cost for the county. This matrix number that you see here, 591, used to be over $1 million.
Okay, that I love hearing, but why do I keep, where is it that I'm hearing that the cost for, especially the retirees, have gone up some more? The cost for their prescriptions have gone up dramatically. Is that not?
To them,
To them, yes, to them. And so we didn't shift the cost there, or?
Well, the drug card that they have is basically the same, they just don't have access to the Canna RX anymore.
But I thought you said, okay.
I
So
didn't say the Medicare population had that.
they could, okay, so they don't have the Canada, okay.
Right. But also their premiums have gone down, so the portion that they contribute has gone down too. Okay, so you have to take it all in a grain together. You can't just look at one side of the equation, you have to look at the full side of the equation.
I thought, thank you for clarifying. I thought I was.
Okay. So the Empire number, Blue Cross, $2,682,000. What that is I've looked at the claims over the last year and a half and taken out any of the large claims. I also had to take out the claims from the Medicare population because they're no longer in your, they were in your claims data all of 2012 and part of 13 because there's run out on those claims. So I had to take that out. I trended it forward using the same trend numbers that Empire would do, and that is the number that we came up with, the $2,682,000 for 2014. Okay. The next number says Empire MAP premium expense, and what that is the Medicare Advantage plan premium. Okay, so that is the cost. $966,000 is the annual cost for the Medicare Advantage plan, okay? And there's currently over 200, I think there's 240 people that have that Medicare Advantage plan. The rate went up from like a little under $300 to about $350 a month, okay? Now that rate includes everything that I was talking about before. All the medical claims on those people, all the prescription claims on those people, the cost to cover, like the stop loss, the cost to process the claims, all that's in one cost of roughly $350 for each of those members per month. And the reason why they can do it, because a Medicare contract, a Medicare person easily costs over $1,000 a month, okay? How can they do it for $350 next year? Is because they're getting subsidies from the federal government, okay? The federal government would rather give them a subsidy than have them go on a plan through the federal government. So they're going to entice groups to keep their members, but do it through a Medicare Advantage plan. And that way it saves the federal government, but it also will save the group, in this case Montgomery County. The next number is the Teamsters premium, okay? And you have certain population that's in the Teamsters premium. And so I got the 2014 rates from Rich, and we have the most current bill. So basically, that's a fully insured product, which means you just pay monthly premium rates. okay? That number doesn't fluctuate based off claims or anything like that. So that number is, should be, unless the population changes, that number should be pretty much spot on as far as what the cost of the Teamsters program is. Yes?
I was gonna ask that.
Oh, I'm sorry.
Yeah. All right, I'm looking at page 5. It's got hospital and medical insurance. I'm looking here in the book. Are these the same numbers? Under the M fund, it says hospital and medical insurance 5259 versus 4933. Are they equal, or is there something that should be added, subtracted from them, or what?
I'm not
looking
sure.
at the budget.
I'm not sure.
We haven't gotten to that, so you're jumping ahead,
Oh, I won't jump.
okay?
Crawl.
Because there was a number when we were preparing the budget for health insurance expenses. And so what Michael is looking at is those numbers that are in the tentative budget for health insurance compared, you don't have, compared to,
I can't answer that.
compared to the estimate that you're putting together now. All right?
So that portion of the program is $4,933,000. Okay. The other benefits there are the dental and the vision. This is the claims portion of the program that we talked about earlier. Okay, so the dental program is about $198,000, and that's broken up almost all Delta Dental and then the MVP claims as well. Okay. The same thing on the vision program, that is $118,000. So when you add those two together, you get another $317,000 in benefits for the dental and the vision claim. Again, that's looking at experience over the last 18 months and trending that forward. The next category is something that is new, that is part of the Affordable Care Act. You also may know the name Obamacare. You know, I know there's a lot going on. I guess they're reaching a tentative agreement as we're speaking right now,
Right.
but that's going into effect. This portion of the program, part of it went into effect already, and part of it is going into effect in 2014. The first thing there is called the transitional reinsurance fee. And what that is going into effect in 2014. Everybody is paying this fee, whether you're fully insured, self-funded. If you're in a community rate, it's loaded in there already, okay? And what that is it's $63 per member per year, okay? So it's like $5.25 a month. And that is a fee to help pay for all these uninsured people that are going to be joining these exchanges that may not have gone to doctors in years and may have large claims. So what they're doing is they're spreading this out. It's a tax that's being charged across everybody that has health insurance. Okay, and there's no way around it, unfortunately. So, and that is the fee for 2014, $5.25 per member per month, or $63 per year. That fee could go up down the road, so it's here to stay at least for the next foreseeable few years. Okay. The next
But is that fee,
it's only for your non-Medicare population because you have them in a Medicare Advantage plan. So you're saving $63 a head on that population as
and
well.
the same thing with Teamsters?
Yes, Teamsters would be in their rate already. Okay, it's being that fully insured rate that they're paying. So this is just for the self-funded portion of the program. The same thing with the patient center research fee. That's called, the acronym for that is PCORI. It's Patient Center Outcome Research Institute fee. Okay, so that's another one of these ones that they've come up with.
Is this pork?
And what that is $1 a year per member. And what that is they're supposedly going to create this patient center that's going to tell about how all these members are working, and they're going to report back out to people down the road. That's what they say that is. That was $1 this year. It's going up to $2 a member next year. Okay, so
Do we know what Sorry, do we know what the transitional reinsurance fee is going to be in 2015?
Off the top of my head, I don't know that.
Okay.
I could look into it, but I don't
No.
have that much.
I was just,
But
both of those are
you know,
very
it's,
curious.
they're not, some of the fees down the road are, we've talked in the past, I think we've talked a little bit about this Cadillac tax fee, which is supposedly going in 2018, and that's based off of what your premium rates are, and if they consider it a Cadillac tax. There's still a lot of talk out there because 2018 is a couple of years away, and Obama will not be president then because his term will run out before then. So a lot of things are subject to change, but these are the taxes that are in effect or going into effect in 2014 that unfortunately we can't get away from. Okay? So that's another $34,000 that you didn't have in the budget in the past. Okay? So if you add all those numbers together, you're at $5,722,000, okay, for the expense of the plan. To put that in perspective, that's $350,000 less than the 2013 number for health insurance, okay? Part of that is, a good portion of that is put in the Medicare Advantage plan, because that saves, okay? Even with these new taxes in here, we're still that amount below. The dental claims and the vision are a little bit lower than what was in the budget last year, but we're still thinking that, you know, this number is solid, and it's going to be in the range of where your overall costs are going to come. Again, based off of your current population. If anything, you know, changes, that could change that too. Okay, so that's the expense side. Okay. If we could turn to page 6 first, I just want to go through this relatively fast. What this is showing what the monthly premium equivalents are going to be for the plan for 2014. And they're broken out between the PPO plan and the EPO plan. Okay? The active single rate is $675. That's about 2% higher than it is this year, okay? Same thing with the 2-person and the family rate, they're 2% higher all the way down through the EPO portion of the program, okay? So that shows you what the monthly total premium is, and then you see what the employer share is, and what employee share is, and what the county share is, okay? Down at the bottom, you see the Medicare Advantage plan, the rate is roughly $350 next year. And then on page 7, it shows you what the Teamsters premiums are going to be next year. When we go through the revenue side, you're going to see it's broken down into several categories, and that's what this enrollment on page 7, 8, 9, and 10 is showing you. It's showing you how many people you have that are in the PPO or the EPO that are single, broken down by department, DSS, sheriff, public health, probation, public works, etc. So this gives you the breakdown of how many singles, how many 2-person, how many families, as well as how many retirees that you have under 65 that are single, 2-person, and if there's any family in that area as well. Okay, so these numbers that you're seeing on these pages, what they are is they're multiplied the numbers times the rates to come up, and then times the employee's contribution are what we're going to see when we now look over on the revenue side.
Now, that's the breakdown that Toski was talking about last night, Sean was talking about, and Social Services was talking about earlier. That we're now currently breaking down by these departments the actual costs of health insurance, prescription drugs, dental and vision, plus the retirees. But they're all broken down by those departments. All right, so that's why this part was important. Okay?
And again, you know, there may be some, as we go through the year, there may be some retirees under 65 that become 65 and then move into that Medicare Advantage plan. When they get to 65, they move into the Medicare Advantage program. So now we can turn back to this beginning page, page 1, to see, you know, now we know what the total cost of the program is, $5,722,000. Okay, and what I had to do is I had to make the premium equivalent get to that dollar amount. You know, you start with your expenses and then you see what revenues you have and if you have to change rates, and that's where that 2% came in. Okay, as you'll see here, the participant assessments here. Basically, we're starting over on the right-hand side where you see the 53. So there's 53 in the PPO active that are single. Everybody see where I am there? Mm-hmm. Okay. So that equates to $365,000 for the year as far as the county's contribution for those 53 people. Same thing for the 33 two-persons, the 42 families. So those three numbers roll up to that $1,533,000 that you see. Okay, everybody with me? Mm-hmm. Okay. Same thing on the EPO. The 177, the 266, and the 513. Those are taking the rates for the EPO times the 85%, which is the county's contribution, and then multiplying it, and that adds up to the $957,000 that you see there. We do the same exercise for retirees. We break them out between these are the retirees under 65. We break them out between the PPO and the EPO, and we utilize the rates that they are paying as well, and what their contribution is there. So those add up, and then we take the MAP, the Medicare Advantage plan, 232 contracts at the time that the budget was done here. So the county's contributing $700,000 towards that 966 that we saw earlier. So the 163, the 147, and the 700 add up to that $1,012,000 number that you see there over on the left, okay? And then we have the Teamsters premium. The county contributes, I think it's 95 on that.
Yeah, 95%.
95% on the Teamsters. So that's 95% of that premium number that we saw on the expense side, okay? So if you add up the $1,533,000, the 957, the 1,012,000, and the 658, that's where you get that 4,161,000 that you see the second column over there. Everybody good so far? Okay. Then we've got further breakdown into the county road fund, the road machinery fund, and on page 2 we have the sanitary sewer district. So all those numbers, we go through the same calculation, and then they all roll up to that big number you see on the front page, the $4,727,000. Top number in the leftmost column on the first page, the $4,007,000. Does everybody understand the calculation? Okay. So going back to page 2, workers' comp insurance fund, $7,500 is put in for that one. That's the same amount that was put in for last year. Okay. Now we go on to the dental and the vision parts. And this is dental, again, this is the county portion, okay? So we start with the total, the $175,848, and then we break that down into the different funds that you see there. The general fund, the county road fund, road machinery, sanitary, and sewer. And the soil and water is no longer part of the budget. They're no longer.
They withdrew.
So, and then same thing with vision. The cost for the county portion is $68,404. Okay. Then down below, we have the employee contribution for the vision program and the employee contribution for the dental program. Again, that's taken the number of people times their portion of the program times 12 months. And then we have the members' contribution for the hospital portion, which would be roughly the 15%, that's the $922. We also see the Teamsters premium there, that's that 5% portion of the number from before. And then we just break out the totals for the next page, the road machinery, the general fund under 65. There are no rebates coming back to that, and we're at the same place, the 5,722,000 number that we had was our expenditures for 2014. So basically, what we did is, we started out, we need to get our costs. What are going to be our costs to the best of our knowledge, you know, based off of the population at hand for 2014. Add in all those extra taxes that are now part of the program. And then what we did is we break it down into the number of contracts that are PPO versus EPO versus Medicare Advantage versus Teamsters. We further break them down into single, two-person family, active employees versus retired under 65. We see what that comes up with for a premium amount. That was short about 2% on the rate, so we had to increase the rate on the self-funded piece for the actives and the retirees under 65 by 2%. And that's how we get to the budget numbers that are presented here.
Yeah, Larry.
Are we open for comments and questions?
Yes, we are.
First of all, a comment. This is the most comprehensive, best explained paper I've seen on the county's health insurance in my 4 years, and thank you very much. I mean, I actually understand everything he says. Okay? That's my comment. Now I have a question on page 5.
Okay.
I'm trying to follow this thing along here.
Okay.
I think it's on page 5. We were talking about the retirees insurance. And then we got to go back to, where was the, yeah, it's on page 6, I'm sorry.
Okay.
The retiree Medicare Advantage plan.
Yeah.
That's $350 a month, that's correct?
Yeah, some people will actually pay a little bit less of that because it's based off of how much money, what their, you know, what their income is. So some people get a subsidy, but I would say 95% of the members pay the $350. We'll pay that amount next year.
That's $4,000 a year, that figures out to $960,000 for 240 people.
Yeah.
I'm wondering, I have Medicare Advantage, had 7 years, and through Senior Blue, I pay $100, I pay $1,200 a year, and it covers, you know, it seems like a lot of money. I'm wondering why. That's the question I have.
Well, it's an experience-rated plan, so Empire actually sets the rate looking at claims and also looking at what kind of contribution that they get back from the federal government subsidies. I would imagine your plan probably is community rated, correct?
Yeah.
You
I
buy.
would assume Medicare Advantage, I mean, that's.
Yeah. I mean, did you buy a plan separately or did you?
No, I bought an individual plan I bought
Okay.
from, you know, from Blue Shield.
Yeah.
Blue.
And are your benefits exactly the same as the
Well,
county
that's the
benefits?
thing I'm coming to. Apparently, I would say with this month, with that monthly premium there, like I pay $25 to go to a specialist, $15 to go to a primary, $150 for a procedure like a colonoscopy, something like that. I assume with that kind of premium right there, you're not paying any kind of co-pays whatsoever on anything.
You're not paying much. I mean, I can't remember off the top of my head, but I know it's, I think it's
That one shows the top of the line.
yeah, we
Well,
did
no,
certain-
this plan design, I think, this plan design,
and we made the drug card as attractive as possible for the
yeah,
Medicare
was designed
population.
for our rural population.
Yeah, I remember we talked about
I
that,
didn't-
but I just. you know-
I didn't bring that tonight, I apologize for that. I can get you that information.
Well, I'm just trying to get to that. I'm wondering if you know, if that is necessary. I know we did discuss that before about what Dominic just said about the drug plan, and
Yeah, because
I'm not sure what conclusion we came to. I don't remember now, but I know my brother has he has a Medicare supplement. You know, that's different.
Yes, that's different.
He has a Medicare supplement, he pays $225 a month, and I know he goes to hospital. He was in hospital a while back here, $200,000 bill, he paid $20 or something, you know.
yeah.
That's why I say this has got to be, I
Yeah,
referred to it, we mentioned Cadillac a little while ago, I got to assume it's a Cadillac plan, I mean. But anyway, that's.
Yeah.
Well, this is A, B, and D.
They're not paying that, like you said, I forget what you said, but it was a $150 charge if you had like, was it?
Oh, myself?
Yeah,
Yeah,
for
yeah.
surgery.
Yeah, any kind of outpatient thing, colonoscopy,
Yeah, that's-
endoscopy, that type of stuff.
They're paying minimal, if anything, for that service when they have it under this plan.
Yeah, that's what I'm assuming. Because like I say, I pay $100 a month, whereas they're paying $350 there.
Right, and when we were creating this to present to the county, and we presented this last year, well, probably back in September or so of last year, is we had to basically mimic the plan design that the current members in the county had. We couldn't give them something that was,
Right.
not as rich a benefit.
Yeah, you made a promise, you have to keep it, I
Yeah.
understand that. Okay. Thank you, Ryan.
Okay,
Yeah, most of it.
I think, anybody else got any questions? Okay, we'll go back to Michael's then, because he had, you haven't got it. In the draft audit that came out, talking about, it spoke about health insurance, and last year's budget from, this year's budget from the year before was, the draft audit said that we budgeted $1 million less than we did the year before. And that they had reviewed the numbers as of I think July or whenever they were doing the draft audit, and they said that they felt that the numbers were realistic, that the numbers would hold. That difference of that $1 million is two parts. One is that we took it in-house, and the second part is because of the Medicare Advantage plan. Those are the two parts that brought it $1 million less. So this year you're talking again a slight reduction, right, based on experience. Michael's question was, we need to get the comparison of between what we see in front of us as the tentative budget and what you just presented to us. All right? Because I think you threw a number out too. That it was 300 and something.
Yeah, based off of the 2013 adopted budget that it was in this format from last year. That number was a little over, it was 6,000,000.
Yeah, 72,000. Yeah,
So this number is 350 less. Now, I can't speak to that because I haven't seen, what's in your big report there. All I can tell you is each year I do a budget estimate, okay, for the county. And in the past, I haven't come here and done the presentation. It's been given to the personnel office, and in the past, they would see fit to take what I'd given them and make the adjustments that they felt was necessary. So again, like I come here to give you this budget tonight. I believe, looking at the experience, I'm looking at the experience, okay? I don't think that they're necessarily looking at the experience the way that I do, all right? That's my job. I've been doing health insurance budgets for 26 years, okay? And my numbers are always numbers that, if I put them on a piece of paper, I believe that they're very realistic. I'm not going to give you something that, what you do with it is up to you, obviously. But I believe this is a very solid budget, and that would put the county on good footing. And I don't even know what the bottom line number is that's in there. But I can tell you, no questions were asked of Benetech in creating that number that's in there. So how that number was created, I'm not sure.
It's interesting.
Right now, the difference in the prior years was that the total would show up in the general fund, and there was this offsetting revenue that came from the other two funds, county road fund, road machinery fund. So what you're seeing here is a separate M fund, an internal service fund, in which that is the total that the 3 different funds would contribute into it. So that number that you see of 4175 is actually, you have to go into, you'd have to go in the road fund and road machinery fund to add the totals of all of the separate ones that match up with this M fund. So what we really need now is, as we finalize this, is determine what the real difference is between what you proposed, pretty detailed.
Yeah, I mean, this is the most detailed budget that, you said, well, this is the most detailed budget that I've done for you guys before, getting down to all those little departments and that, so I will tell you that. So I had to look at everything, and, I will say that in the number you're looking at too, there probably wasn't any money thrown in for those taxes, because, I'm not sure they even knew about those taxes. That's something, as healthcare consultants, we have to keep up on that kind of stuff. 'Cause legislation can be changing on a daily basis. So,
Okay, any questions? If not, thank you.
Thank you.
And then,
Thank you.
like I said, we'll have to get
yeah,
together and,
if I can help you with any of that part, but
Yeah,
I don't know
just-
what went into that part, so I can't really speak to that.
okay.
Actually,
If I can help you with anything
Hold on,
else.
I got one question here before we,
real quick, I just want to learn more about those 2 fees.
Or their taxes, but.
Right, of course. Online, probably, or do you have, or could you send me any information if you have it?
On what the.
The
fee-
dollar, which is going to go up to 2 and 63.
Yeah, we can get you something.
Thank you so much.
You're welcome.
Than't you so much for your
You're welcome.
time. I appreciate it.
You're welcome.
Dominic, I have a check here, let me leave it.
Okay. Yeah, well, bring it up and then we'll get ready for probation here. Here, you want, Bart, has he got your email address or is he gonna send it to?
Marissa,
I have it.
Yeah,
I have it.
and Sandy has it.
Okay.
Okay,
Alright.
thank you
Good
so
night.
much. Thank you, have a good night.
Gentlemen? Lucille.
Lucille,
Remember that song, Lucille?
Where is she? Okay, what page are we on?
Cheryl, turn the camera off, I'll sing their song.
That's right.
Lucille.
What song is that?
Yeah.
Not in between.
If they do anything for